I was that child that just masked all day. I know what it feels like to feel like you're stuck and you don't know where to go. Every teen has struggled. There are some teens that just struggle a little bit more. If you have a neurodivergent teen who is struggling with their mental health, I'd want to tell you about Mosaic Minds. Mosaic Minds is an outpatient mental health program in Arizona built specifically for neurodivergent adolescents ages 11 to 17. We offer intensive outpatient services and partial hospitalization programs for neurodivergent teens. I'm Lena. I'm the Executive Director of Mosaic Minds. I'm also a neurodivergent person myself and a mother of 2 neurodivergent teens. So when I say we understand what your family is going through, I mean that personally and professionally. In this video, I'm going to walk you through what Mosaic Minds is, who we are, and what makes us different. Let's get into it. What Mosaic Minds is. Mosaic Minds is an outpatient program. We offer IOP, which is intensive outpatient programming, and HP, which is partial hospitalization programming. We are a neurodivergent affirming program. What that means is you do not have to have a formal diagnosis of ASD or ADHD or any other diagnoses, but if you have that, then it is a safe place for you. At Mosaic Minds, we offer a variety of therapeutic modalities. We offer different settings to participate in group. We have our sensory room, which we do a lot of groups in. We have our art room, where we do a lot of therapeutic art. And we have different areas, including outside near the lake, to be able to have these kids calm their nervous systems so that they can hear the message, that they can relax, and that they ultimately feel comfortable opening up and talking about what's really going on. So you don't necessarily have to have a formal diagnosis that would deem your kiddo neurodivergent. It is just a place where the neurodivergent adolescent can feel safe, can feel comfortable, and can feel like they belong. All of our staff at Mosaic Minds have years of experience with adolescents, from residential settings to outpatient one-on-one therapy to community relations within the community and knowing the best places, the best people, the people that we ultimately trust with giving referrals to, say, for psychiatry, assessments, and other programs if need be. At Mosaic Minds, we are not just doing therapy all day long. So we do have one-on-one therapy, we have group therapy, but we also like to remind these kids that they are just that. They are kids. So we have fun. We're dancing, we're singing, we're going on outings, we are doing various types of art activities so that the day is broken up to not have to just really go deep into what's really going on with them all of the time. There's a time and a place for that, and we provide that, but there's also a time for community and connection. We eat together, we play together, we go outside, we look at the animals, we have fun at Mosaic Minds. So Mosaic Minds is a primary mental health program. So what that means is we are focusing on what's really going on inside your child. We are treating depression, we are treating anxiety, we are catering to kids that may be a little bit more sensitive to their environments. We offer a softer approach in easing into that communication. So if the kids need to take breaks, they can go into the sensory room, they can relax with the music and the dark lighting. We can do groups in our art room. So the kids are, molding clay, they're painting, they're coloring, they're doing activities that are expressing their emotions, but maybe not in the typical way that you would in a very kind of formal, boring group setting. At Mosaic Minds, our entire staff works together and communicates with each other on a daily basis. So what is being done in group is always communicated to our primary therapist, so that when the kids are in their individual sessions, the therapist already knows what has been discussed in group. Maybe if there was a breakthrough in group that the therapist can then dive deeper into. From our executive team to our group facilitators, to our therapists, to our program manager, we're talking all day long so that everyone knows exactly what's going on with each kid each day. So at Mosaic Minds, each staff was handpicked because they truly understand adolescents. So we work with children 11 years old to 17 years old. So each staff member, whether it's our therapist, whether it's our executive director, our group facilitators, our specialists, they are so well versed in adolescent psychology that they understand the type of communication that's most effective. They understand that if kid is not responding or if they are having a rough time, they understand that there's so much that could be going on in just that one situation. So if a child is having a hard day and they are not participating in group, the staff, whether it's the group facilitator, therapist, clinical director, whoever it is, understands that how the brain works in a teen. So where they are in their brain development, where they are in just their hormones, where they're at with past trauma, and how that could be affecting them in the group or in the individual session. I think that we are different from some of the other outpatient programs for adolescents because we really do take the time to develop an individualized treatment plan, and we understand that teens, especially neurodivergent teens, while they need that structure, we also need to be flexible with what's going on inside of them every day. A lot of the kids that are in our IOP or in our HP program, they're very sensitive, right? They are incredible kids that are so kind, so supportive of each other, but they can also get triggered by something that maybe someone would think is not a big deal. You know, whether it's how the environment feels, how it looks, how it smells, anything like that, we take that into consideration and then we modify the groups, we modify possibly the therapeutic modalities to ensure that the child feels safe and supported so that they in turn can open up and be able to share what's really going on with them. So each of our staff understands both professionally and oftentimes personally what it means to be a teen that struggles, whether that is understanding on a very deep level what depression is in a not fully developed mind, how ADHD can affect anxiety, how ASD can affect social interactions. So each staff member takes their own story and brings that to the table as well. So they are educated, they have gone through years of training, they specialize in specific areas, whether it is neurodivergence, whether it is disordered eating, whether it is depression, anxiety. Each of the staff members understand, whether it be something that they've learned in their master's program or something that possibly they experienced as a teen as well. So as the executive director of Mosaic Minds, I bring a lot of my personal experience, both as being a neurodivergent teen and now also being a mother of two neurodivergent adolescents. I have been in the place of being that child that looks like everything's normal, looks like everything is fine. But internally in my heart, in my mind, things were not okay. At the time, there weren't a lot of words for that, and there wasn't a lot of digging into what was going on. I was that child that just masked all day and just fell apart at the end of the day because pretending to be something that I wasn't was absolutely exhausting. I didn't see the impact that it had on my own development, my own struggles, until I had children that were very similar to me. And so I have been that parent that has been sitting there in a therapist's office, sitting there in an IEP meeting, trying to figure out how to help my children. And me being someone who is a mental health professional, I have been doing community relations and building curriculums for mental health programs for years and years. And then when something happens to you and you are actually so worried about your own children and their safety and their growth and their happiness, I know what it feels like to feel like you're stuck and you don't know where to go. So Mosaic Minds was created out of the absolute passion for supporting families, supporting the teen that is struggling, but also supporting the caregivers, the parents, other siblings, so that everyone can grow and learn and heal together. I think that part of what we do is we really try to break the stigma around mental health in general. So we're normalizing that most kids struggle with something. Most kids are having problems, with their friends. They're anxious about their grades, or maybe they don't feel like they fit in. Every teen has struggled. There are some teens that just struggle a little bit more, and they just need to know that they're not alone. And the parents or the caregivers need to know that they're not alone either. So we provide that community, we provide that support, we provide the therapy for the teen, but we also provide the community and we welcome the family, we welcome the teen, and we build that foundation with them. We make discoveries, whether it's in groups, whether it's in the individual therapy, whether it's just sitting there in the lunchroom. We make discoveries, we dig into them, we share to an extent with the families so that they can know what's going on inside. And then we work on the communication between the adolescent and the caregiver or the parent. So we're really trying to introduce the skills and the tools and the ways to regulate. We introduce that to the teen. We also introduce that to the parent or the caregiver. So we are making sure that the communication is strong with what we're doing at Mosaic Minds, whether it's in our full day program, whether it's in our evening IOP. We're communicating what is happening there, and we are offering those same tools to the families as well.